In medical schools, anatomy department, they issue bone bags. Approximately 4 or 5 students they share a single bone bag in which bones of upper and lower limbs are present. The whole class is divided into batches of 50 to 60 students, and the demonstrator teaches these bones in the demo room or dissection halls. And it becomes difficult for most students to cover these bones in those lectures, and mostly they have to cover these bones on their own. So in this video, I'm going to answer 3 important questions, and I know that you already know the answer of question number 1 and 2, but I still want to touch them briefly. So you have given your block 1 exam, and you know that there are 2 parts. One is your written exam and other is your Viva and ospe. You don't need to do bones for your written exams. Like, you can simply skip these bones for your written, but they are very important for your Viva and ospe, and you have to cover them before your Viva and ospe. Next question is when to cover these bones. I will suggest you to do at least 2 to 3 bones per week, because some students have only 1 or 2 days between their written and Viva according to their batch distribution. So it becomes difficult for students to cover 10 to 15 bones in just 1 or 2 days when they have already other stuff to do as well. So now the third question, and I want to discuss it in a detail. Let me tell you some important Viva questions so that you can guess what things you need to learn, memorize for related to the bones. So the first question is identify the given bone. Okay. Second is to which side this bone belongs. This is your side determination. The third question is mark the important features of this bone, or they can simply point at some specific part of the bone and ask you what is this. Or the first question is they are going to ask you about the attachments of muscles, ligaments and tendons. They can also ask you in which joint formation these bones are taking part, and some examiners they also ask what will happen to this nerve if there is a fracture of this part, and which blood vessel is going to bleed if there is a fracture of this part. So these are all questions. So the channels I want to suggest you for covering bones are Dr. Vian, Angelina, and the Johari MBBS. I have mostly watched the videos of Dr. Vian, and the merit of his channel is that he covers details of every feature, and he also describes the details of attachments of tendons and ligaments. But its videos are a little bit lengthy as compared to the other two. But if you are covering 2 to 3 bones per week, then you have time to watch his video. So to do a specific bone, start the lecture of that bone, take the bone in your hand, and always do bones in groups with your 1 friend or your 2 friend, but always do bones in groups. So start the video, and if Dr. Viren is pointing towards the head, touch the head of that bone. And if he's saying that it's globular, then move your finger around. It's showing that yourself that this part is globular. And if it's showing you deltoid tuberosity, it's actually a part of humerus bone. And head is also a part of humerus bone. And humerus is your bone of arm. So when he says that here is rough, so actually feel the roughness of that bone. And when you are going to complete the video, so then discuss it with your friends. Some points are missed by you, some by him or her. Then when you start discussing a whole bone, it will be done. So you can done a single bone in just 30 minutes approximately, and it will going to help you a lot. So this is the best method, but if it doesn't suit you, first give it a try. Okay, I will say give it a try, and if it suits to you, stick to it, and if it doesn't, then try another method. Okay, so that's all from my side. If you like this video, click on the like button and also subscribe to the channel. Thank you so much for watching this video.